Hello, and thank you for joining us today. My name is Cameron Hilt, and I serve as the Program Director for the Upper Midwest Telehealth Resource Center, or the UMTRC for short, which is a program of the Indiana Rural Health Association. And today I'm going to talk to you a little bit about virtual care basics. So starting off first with some of the UMTRC's services. So we are one of the 14 telehealth resource centers, and we currently serve Illinois, Indiana, Michigan, and Ohio. We serve as part of a national consortium, and really our main purpose is to serve as a one-stop shop for any telehealth questions that you may have. So feel free to reach out to us over email or over the telephone. We also offer presentations and trainings. So we offer a monthly webinar series, as well as a bi-monthly podcast called A Virtual View, as well as a virtual office hours, which can sometimes be over a variety of different topics, or it may just be an open Q&A for you to come and ask any telehealth questions that you have for the UMTRC staff. So before we dive in, I really want to take some time to clarify some common terms that are utilized in virtual care and telehealth specifically. And so many of you over the past couple of years have probably gotten a lot more familiar with telehealth than you ever have before. So during the COVID-19 pandemic, telehealth adoption has exploded all across the country. And so now we're seeing more and more services that are offered through telehealth, and accessibility for the services is much greater than it has been in the past. So, some restrictions that existed for telehealth prior to the pandemic have been lifted, as well as, currently we're hoping to see those restrictions stay permanently, as well as reimbursement for telehealth services to increase so that it continues to incentivize healthcare providers to continue to provide that service for their patients. So next, you may have heard some of these terms used interchangeably. So I wanted to differentiate between telehealth and telemedicine. So telehealth, think of it more as the large umbrella term. So it kind of captures everything underneath it. So it includes a broader field of distance health activities, as well as some clinical remote monitoring activities as well, which are usually done within the home. Now, telemedicine is very specific. So it is a billable, interactive clinical service. And so this is when you're actually sitting down, having an appointment with whatever healthcare provider that you're meeting with at that time. But you may hear terms such as e-health, m-health, video visits, or virtual care also utilized to describe different telehealth services as well. Now, and another distinction to make as well, in case you do hear any of these terms utilized whenever someone is talking about telehealth, so an originating site as a patient is always going to be wherever you are located. So whether that be at your home, at your school, or at a healthcare clinic, wherever you're receiving that care is ultimately going to be that originating site. The distance site is always going to be wherever that healthcare provider who's actually giving the services, it's wherever they are located is the distance site. So I want to make that clarification just in case you do end up hearing those terms again in the future. So now that we've clarified some common terms, let's talk about some ways to prepare for a telehealth appointment. And so the National Consortium of Telehealth Resource Centers that I mentioned before actually came out with a resource of 4 questions to ask yourself before trying telehealth for the first time. And so telehealth services have become way more widely available. So there's a variety of different services you could seek out for, but there's also a lot more options when it comes to the different doctors that you interact with. But one of the consistent concerns that we hear is that patients are concerned about, their privacy whenever they're receiving a telehealth visit. And so we do want to clarify, that a telehealth visit comes under the same level of restrictions and regulation that any in-person visit would require as well. So any healthcare organization that is providing telehealth services is always going to take every effort possible to ensure the privacy of your data. As well as, they're always going to make sure to clarify with you, if any other individuals are in the room, so that they can also ensure that everything is private with the conversations that you're having. Next, when it comes to telehealth, the only equipment that's needed is to have good internet connection, access to a tablet, a laptop, or a smartphone. And so, if the services that you're looking for are available through telehealth, you've found a provider that ultimately you can trust, you can know that it's safe, and you have the devices available, that's a good opportunity for you to seek out a telehealth service. But also, too, I wanted to point out the Upper Midwest Telehealth Resource Center. We have a handout that's focused on, how to prepare for a telemedicine visit. So this goes through what to do while you're in the visit, as well as what to do before. And so I do want to point out a couple. The first one being to make sure always before a telehealth appointment, make sure your equipment is working and that you have good access to Wi-Fi. This will just make sure you don't have any issues with your audio or your camera, as well as connectivity whenever you're actually meeting with that doctor during that telemedicine appointment. Additionally, you want to try and eliminate any distractions that may be in the area. So it's really important, if you can, to try and be in a private space. This also ensures your confidentiality, but also make sure that your provider that's on the other end can easily understand what's going on and how they can help you. Now, during the appointment, one of the biggest things is to have the same mentality that you would if you were receiving an in-person appointment. So you're there to receive the same level and quality of care through a telemedicine appointment. Just the way you're receiving it is slightly different. So if you can avoid, things that may be distracting or may make it hard for your provider to hear you, that's always going to be a best practice whenever you're receiving a telemedicine appointment. So I want to touch on briefly, when we talked about some of the requirements in order to be able to receive a telemedicine appointment, one of the things is access to high-speed internet, or to have better access for broadband. And so I wanted to point out that the federal government does have an affordable connectivity program. So if you or any individuals that struggle with access to high-speed internet, this is a program that could connect them to funds on a per month basis to help them to be able to have access to that. Now, to get all of the details of the requirements and what you need to do to apply, it's always going to be best to go to the source, which is the Universal Service Administrative Company, or USAC for short, for more details. Next, let's look at telebehavioral health. So telebehavioral health is one of the easiest services to provide during virtual care. And telebehavioral health is any service that is focused on mental health for the patient, done by a mental health professional. And so it's one of the easiest ways to receive care through telehealth, because it's not something that requires, typically does not require vital signs, and it just incorporates a private conversation. So, there are some advantages to being able to seek out behavioral health care through telehealth versus having to go in person. And so one of those reasons is that it's not always convenient to have to travel to a certain location to receive that care. So it could be because you have to travel a long distance, or because that you don't have access to good transportation to consistently get you there. But when it comes to your mental health, consistency is always going to be important, and having easy access to that care is important. And so telebehavioral health can have a huge advantage with that if either one of those are barriers for you to actually going and seeking out care. Additionally, if you have issues with scheduling, either because of childcare or with work, it can also help because there's not as much of a time commitment involved to receive that care than if you were to have to commute somewhere else. We also realize that, stigma for mental health conditions is still very much alive. We've come a long way, but there still is stigma. And so, telebehavioral health can be a way to curb if you are concerned with, other individuals finding out that you're receiving behavioral health services, or you're afraid of what others may think. This is a way to receive it in a more private setting to make sure that you're still getting the care that you ultimately need or you want. But you may not run into someone, while you're visiting there, or other individuals see your car in the parking lot and may recognize it. And so it offers some of that privacy that you don't always have when you're doing an in-person visit as well. But ultimately, telebehavioral health helps meet you where you are. So regardless if you feel like you need to only have a check-in occasionally, you only want to meet with a mental health professional one time a year, or you want to meet more frequently, ultimately, telebehavioral health is just another tool in your toolkit that helps you make sure that you are improving, maintaining your current mental health or quality of life. And so by no means am I saying that it's a complete replacement for all in-person behavioral health visits. There are certain situations or preferences that people may have that go towards that. It's just an additional tool in the toolkit to improve your mental health long-term. And the UMTRC, we also have another resource that's focused specifically on what are some of the different preventative services that you should be looking to have, as well as the consistency. And I do want to point out here that we did highlight having a relationship with a primary care doctor, where you're at least checking in with them one time a year for a routine checkup. Now, a primary care physician is always going to be one of your best resources when it comes to your mental health as well, because they can serve as a great referral source to connect you to a different individual to be able to help you. And so I do want to say, even if you don't plan to receive behavioral health services consistently, consider having an annual checkup with someone who can just check in on your behavioral health, because just like you check in on your physical health, you should also be checking in on your mental health as well. And telebehavioral health can make that easier. So when it comes to what a typical behavioral health visit looks like, as I said before, sometimes it comes through a referral method, through a primary care physician, where they will they'll refer you to a behavioral health provider, where they will do an intake assessment, where they're just basically feeling out, does a telebehavioral health visit fit for you? Do we need to do any in-person visits, and how frequently do we need to see you? To where then you'll move into an actual care plan has been established, and you start to attend and have regularly scheduled appointments. Now, I know the burning question in a lot of your minds is, this is great, but will my insurance pay for telebehavioral health visits? And, for the most part, the answer is yes. So when it comes to Medicare, Medicare has released a lot of restrictions for telebehavioral health. So you can seek that care either through audio and visual, or you can actually receive mental health care through a telephonic consultation as well. When it comes to Indiana Medicaid, it does for now require an audio and video component. There is no current telephonic option that is reimbursable through Medicaid. However, we do see that changing in the future. We just don't know exactly when that will be yet. And then lastly, if you have private or commercial insurance, either through Anthem, UHC, an employer, a lot of, private and commercial insurers are providing coverage for telebehavioral health, but it's always best practice to confirm coverage by checking, the customer service line that's listed on your insurance card or on the insurance company's website. And if for some reason you end up finding out you do not have coverage for telebehavioral health, don't let that, affect you. There may be an opportunity, if you reach out to that provider and say that you're willing to self-pay, there's actually some opportunities where, paying through self-pay through a telebehavioral health visit may actually be cheaper than going in person as well. So you do have options available when it comes to that as well. And then lastly, if you have benefited from telehealth, or you're looking for, more options for telehealth in your community, I wanted to walk through some quick steps on how you can begin to advocate for telehealth. One of the easiest ways is to reach out and connect with a local representative on bills related to telehealth or broadband access. And you can do this by visiting congress.gov and actually searching for those two particular topics. And it will pull up a long list of different bills that are currently available focused on those topics. And so if you click into a bill that you're interested in, it actually gives you an option, and you'll see, so the bill overview is on the left, and on the bottom right of the screenshot, you'll see a give feedback on this bill and contact your member. So by clicking on that, it'll actually give you an opportunity. If you don't know who your representative or your senator is, this can be an easy way to find it by typing in your address, and it will give you a list. But really, now that you have that list and you have that bill that you're interested in, this is an opportunity to reach out to those individuals directly and really just tell them about your experience with telehealth and how it has impacted your life, your family's life, and your community. And that goes the same for anything related to broadband in your community. Ultimately, bringing in some of that real world experience can be very impactful in seeing those bills progress in the future. So that's all I have for you today. So thank you again for tuning in. And so, there's a lot of different ways that you connect with the UMTRC. So you can connect with us through our website, our podcast, our YouTube channel, or through any of our social media outlets. But lastly, feel free to reach out to us at our info@umtrc.org email. Thank you.